Welcome to video part 2 of stretching out the inner knee, getting rid of some knee pain. Let's go. Follow me. Fill out your tight spots. Extend the leg to try to feel the tension behind the knee. So a little bit of a hyperextension stretch when you pull up on the foot. The more you internally rotate the hip, you should feel more pressure on the knee if this is your problem. Next, we're going to swing the leg out to the side laterally and feel the tension that lands in the knee by the knee kind of floating here in this stretch. Internal hip rotation is your knee forward. External hip rotation, your knee is up. If it hurts mostly when you bend that knee and stretch the hamstring, you've got the hamstring problem, and more than likely your tendon pain is on the inside of the knee. To prepare for the W sit, we're going to do this movement a few times to open up the hip, extend the hip, and then bring the hip back, and we'll start to open things up. This position also is getting into the W without sitting your butt on the ground and your knees are wide. But W sit is the knees a little closer so you can get your butt on the ground. Grab your foam roller because this is going to help elevate your knee, and we're going to swing that leg and hip around to try to foam roll the inside of the knee. Just sit yourself in a plank position with your arms. Your hips are up off the ground so you can get movement on the roller. You can go with the fibers and against the fibers about mid thigh and then about lower knee, upper calf area. Move around up the thigh, inside knee, even inside calf. There's no right area except the area that you feel the most discomfort is the area that you want to work on. So up and down is going with the fibers. Rotating my femur is going across the fibers of all those tendons that have to attach from the inside of the knee to your upper calf, under your calf muscles, under a lot of layers. So they're superficial and they're also deep in their attachments, but there's not a lot of layers on the inside of the knee. So you should get good contact. Next, go higher in the thigh, up towards the groin, mid quad, adductor, and go back and forth like you were doing with the lower leg. Opening up the hip again to prepare for the W sit, and here it comes. First, you can use the roller to help you by sitting on it, but your toes need to be out to the side. This is the sitting position little kids do, and we tell little kids not to do it so they don't ruin their hips in the future because they're so flexible when they're young. But it's something that as adults, as we grow, we should actually be able to do. You'll slowly adjust to get your knees wider and your hips a little looser here, so just jiggle it out and let yourself adjust. Rotate, opening up the groin to one direction and then the other. But we can't babysit that roller the whole time. The object is to get your butt on the ground, slowly. You're putting pressure on your heels because they are going to want to lift up, but we really want the joint of the knee and the tibia to rotate against each other and really open up that tendon area. Just be patient, grasshopper. Stretching takes time. But you can also cheat. If you can't get your toes out there, they can be behind you at an angle, about 45 degrees or so instead of straight out. There's a lot of stretching that needs to happen with your foot as well to get into W. So you can use the foam roller again and sit on it, so then you can see that your toes can go back out at different angles. So I'm going to pull them up because I've got space between my butt and the ground. So I've opened up the angle between my hip and my ankle and my knee, all of it. But get rid of that foam roller if you can. Get back into the position if you can. Lean back and your knees can raise up on purpose. Hi, Parker. And bring them back down. This is just to give a little massage on that inner knee, help you out. Again, I can relieve things by angling my foot back towards that 45-degree angle or less to give myself a break while Parker does acrobatics in the background. When I just kind of wiggle my ankle, I'm just kind of encouraging that ankle to open up more. What do you feel on the inside of your knee now? Hopefully there's relief, especially if you did video part 1. Rocking back and forth is just a gentle massage on the knees. I'm feeling tension off my quad right here. So wait, there's more you can do. If you're also getting some restriction off of the quads, feel where that is. Then I'm going to show you with the lacrosse ball how to kind of push and push laterally into that quad to stretch it while it's under tension. You can also use your elbow here. Push to the outside. Pushing that muscle over moves it. Moving it stretches it, especially while it's under tension. And if you're looking closely at that muscle, you can see it get pushed to the side. And even when I gotta pop over it because it's way too tight. So push laterally into it and get it to stretch and move. This just tells me I need to do some more foam rolling on those quads, but not like this. Instead, you want a more pointed contact. So the elbow or the lacrosse ball is way better. You can do this face down on the ground as well, or the rumble roller that has all the spikes on the roller. But I'm just using my elbow to push down on the ball, encourage that muscle tissue to move even more. Oh, PK, move out of the way. Never dull when you have pets. Thank you for watching and following along in video number 2, mobility conditioning.